Thank you. My name is Dawson White from the United States, representing myself and addressing the coca leaf. I research plant biodiversity and evolution. I make many collections of plants, such as the wild relative of coca you see here, and work with academic teams and communities in South America. I'm also the leader of the recent article published in Science on October 15th with 13 co-authors across disciplines, where we define the scientific consensus on many issues of interest to the WHO Critical Review. In this presentation, I summarize many points. The conflation of coca and cocaine is strengthened by its current scheduling, which disrespects culture, distorts science, and sustains unjust policies. One example here is from the member state questionnaire, in which several countries reported serious health risks and emergency room visits, which are clearly cases of cocaine toxicity, not coca leaf use. What is the coca leaf? Well, there are 4 cultivated varieties, each grown in distinct regions with their own diversity and cultural histories. Remarkably, these 4 varieties were created from 2 or 3 independent domestication events by different peoples at different times in South America, proving this to be a very useful plant. Evidence of coca leaf use dates to 9,000 years ago, making it one of the oldest crops in the Americas. It's integrated today into more than 100 indigenous cultures. These insights prove coca is a foundational crop, contrasted with the modern narcotic innovations that are the other 3 drugs under review in this meeting. Today, over 11 million people use coca as a mild daily stimulant, like tea or coffee, and as an effective herbal remedy. We certainly lack clinical evidence of the efficacy of these remedies, but there are a wealth of studies showing promise as detailed in the critical review report. Coca's utility transcends into ritualistic aspects, giving it a role as a medium of communication, reciprocity, and collective identity, reinforcing social cohesion and the transmission of ancestral knowledge across generations. It is a cornerstone crop. Turning to policy, these are the main concerns that were raised at the CND thematic meeting on October 2nd, 2025 regarding scheduling changes. First is the public health concern. Second, the criminal and diversion concern. Third, the regulatory concern. I'll go through these. The WHO Critical Review Report has done an excellent job at summarizing the health effects of coca leaf use, confirming almost no evidence of harm except for occasional oral irritation. So we'll move on. Concern number 2, will legal coca leaf facilitate diversion into cocaine production and strengthen organized crime networks? We argue no, because currently 90% or more of coca leaf goes into the illicit cocaine market. By enabling illicit market, descheduling would shift production to licit, community-governed markets and reduce illicit productivity. There's a foundation for this legal market and lots of interest in its expansion. I'd like to highlight one common misconception, which is that there's higher cocaine in the new coca strains. Surprisingly, new strains from Colombia used for cocaine actually have the same cocaine content as traditional varieties. This is published, as well as shown in the unpublished data there on the right. And this indicates that increases in cocaine yields per hectare are driven by other factors like improved agricultural practices. Third, what are the benefits of removing coca from Schedule 1 when current frameworks are claimed to be effective and flexible? Well, I'll just point to the graph of the increase in cocaine production in Colombia from the UNODC SIMCHI report to show that current frameworks are not effective. In addition, descheduling would provide benefits to pursuing scientific research and diverting coca leaf to legal markets. Third, prohibition directly conflicts with human rights, specifically the UN Declaration on the Rights of Indigenous Peoples. Stakeholders have further elaborated on this. This declaration of the traditional producers and consumers of the coca leaf directed at the WHO is signed by organizations and people from across Peru, Bolivia, Colombia, and Brazil. Their message to the WHO is clear and unified. First, remove the coca shrub from the list of controlled substances. Second, recognize coca's traditional and medicinal uses as part of indigenous cultural heritage. Third, clearly differentiate between the use of the coca leaf and the abuse of its alkaloid cocaine. They also call for public health policies that respect cultural rights and ancestral practices. They urge scientific research on coca. And finally, they support legal, regulated access to coca for traditional, nutritional, and medicinal purposes. In conclusion, current scientific evidence and stakeholder consensus support descheduling, which will allow coca policy to be reconstructed in alignment with science and human rights. Thank you.